Please watch this video provided by Virginia Oncology Associates regarding cancer genetic testing. During this video, we'll give an overview on genetic testing. We'll review what genetic testing is, how it's completed, and how it can impact your care decisions and other family members. Sometimes inherited changes in cancer genes are passed on in a family, or they're hereditary. When someone is born with one of these inherited changes, it can increase their risk of developing certain types of cancers, such as breast, ovarian, prostate, and pancreatic. Your doctor recommended genetic testing for you because of the type of cancer that you were diagnosed with can sometimes be caused by one of these inherited changes. Two of the genes that we'll be testing are called BRCA1 and BRCA2. Everyone is born with BRCA1 and BRCA2 genes. However, some people are born with inherited changes or differences in these genes that put them at an increased risk of developing cancer. Inherited changes in BRCA1 and 2 are linked with an increased risk of breast, ovarian, prostate, and pancreatic cancer. This test is able to check for those changes or differences in these cancer genes. Along with BRCA1 and 2, we will look at other genes that are associated with different types of cancers within this test. Genetic testing is extremely helpful. It can be used for surgery decisions, for example, in the case of breast cancer, choosing between a lumpectomy versus a mastectomy. It can help your doctor with certain medication decisions for treatment, along with deciding on maintenance therapies which are designed to help lower the risk of recurrence. Genetic testing can also help us know if you are at risk of developing another different type of cancer and can therefore help your doctors develop a personalized screening plan to better care for you. If a change is identified, we likely would recommend genetic testing for your family members. If you were to test positive for a change, your siblings, children, and parents would have a 50% chance of testing positive as well. We can then personalize your family members' care to better screen for cancer. This may include earlier, more frequent screening, or avoiding unnecessary screenings if your family members were to return without the cancer change. Next, we will discuss how the genetic test is done. First, we ask that you review and sign the consent or permission form for genetic testing. Please let your doctor know if you have any questions about the form or genetic testing. You will then have your blood drawn today for testing, and it will be sent to an outside laboratory. The genetic testing lab will get permission from your insurance company to run the test. If your copay is over $100, the lab will contact you before completing it. You can then choose to pause or cancel the test. If you have more questions about testing, you can make an appointment with one of our cancer genetics specialists before proceeding with the test. Your doctor will review the results with you when they are available. It typically takes 3 weeks for the results to return. A positive result means that you are found to have a change in a gene that increases your risk of cancer. With a positive result, your doctors may change your care and medical management. With a positive result, we would likely also recommend genetic testing for family members, again with children, parents, and siblings having a 50% risk of testing positive as well. Family members should talk to their medical providers about genetic testing. The next result we could get is a negative result. This means we did not find a change in a cancer gene. With a negative result, we would not recommend changes to your screenings or treatments. Even with a negative result, family members may be at an increased risk of cancer, and your doctor can discuss if family members may need extra cancer screening. The last result we could get is called a variant of uncertain significance. This means that we found a change in a cancer gene, but we are not sure what it means and if it is harmful. This result currently does not change your medical management, and we will contact you in the future if it does. Please review and sign the consent form for genetic testing and let us know if you have any questions. Genetic testing is an important part of cancer treatment, and thank you for helping Virginia Oncology take the best care of you and your family.